How is multidrug-resistant TB, MDR-TB, different from regular TB? Imagine a battle between bacteria and medicine. Regular tuberculosis is caused by bacteria that respond well to standard medicines, making it easier to treat and cure. But sometimes, these bacteria change and become resistant to the most powerful drugs used to fight them. That's what makes multidrug-resistant tuberculosis, or MDR-TB, so challenging. The main difference lies in how the bacteria react to treatment. Regular tuberculosis bacteria are sensitive to the first-line drugs, which include isoniazid and rifampicin. These drugs are very effective, and most people can be cured with a 6-month course of treatment. In contrast, MDR-TB bacteria are resistant to both isoniazid and rifampicin, which means the usual medicines won't work. This resistance makes the disease much harder to treat and requires the use of second-line drugs that are less effective, more toxic, and often need to be taken for 9 months to 2 years or even longer. Another key difference is how doctors diagnose these types of tuberculosis. For regular TB, simple tests can detect the bacteria and confirm if the bacteria are sensitive to drugs. For MDR-TB, special tests called drug susceptibility tests are needed to find out if the bacteria resist the drugs. Rapid molecular tests like the expert MTB-RIF assay can quickly detect resistance to rifampicin, which is a good indicator of MDR-TB. Early detection helps start the right treatment sooner. Treatment also varies greatly. Regular TB treatment is shorter and has high success rates, often over 85%. MDR-TB treatment takes longer, is more complicated, and success rates are lower, around 60 to 63% globally. The drugs used for MDR-TB can cause more side effects, such as hearing loss, kidney problems, or nerve damage, making the treatment tougher for patients. Both types of tuberculosis spread through the air when an infected person coughs or sneezes. MDR-TB can develop when regular TB is not treated properly or completely, allowing bacteria to become resistant. It can also be transmitted directly from person to person. Because resistant bacteria are harder to treat, MDR-TB poses a serious public health challenge, especially in areas with limited healthcare resources. In summary, MDR-TB is a form of tuberculosis caused by bacteria that resist the most effective first-line drugs. It requires longer, more complex treatment with less predictable outcomes. Early diagnosis, proper treatment adherence, and public health measures are essential to control its spread. If you or someone you know is dealing with tuberculosis, it's always best to consult healthcare professionals for personalized advice and care.